Thank you for joining us today. I'm Angie and I'll be your moderator for today's session. I'm the CEO of Yazzo Marketing and Business Development Strategies, and we're a marketing and communications firm. We work directly with Reclamere and Angie Singer Keating on their marketing and public education efforts. For those of you who've not joined us in the past, I want to give you a brief introduction to Reclamere. Reclamere is a data security company offering a full range of specialized IT asset management and information security services. Founded in 2001, Reclamere is a leader in providing very client-centered, environmentally compliant management solutions for end-of-life computer equipment and for data destruction services. In addition to robust data security services now offered in a subscription-based model called Data Security 360. In fact, they are one of the only companies providing a full-service data destruction and data security model. So before we get started, I want to take a couple seconds to go over some housekeeping items. Today's presentation is being presented in a conversational panelist format. So we will be opening up at the end and welcome you to join in the conversation. The way you'll do that is by using the question feature on your GoToMeeting panel. We will also be following up with all registrants and attendees to answer questions that we may not get to, and we certainly want to provide you with additional information. I do want to note that this webinar is one in a series, and it has been developed to fit the needs of the targeted audience. So that means that some basic assumptions regarding general knowledge of what's covered under HIPAA and the history of HIPAA have already been applied to the presentation. So please know if you need some of that additional base information, we're certainly happy to speak with you and schedule some time after the presentation to do so. Lastly, I want you to know the webinar is being recorded, so we'll provide the link to you in our reach out and certainly welcome you to share the information with other members of your team or within your network. Now, I'm very proud to introduce to you our expert speakers today. We have with us today both Angie Singer Keating and Renee Martin. Angie brings over 20 years of professional experience and consultancy services. Within the last 10 years, she has really focused on computer forensics, data recovery, data destruction, security incident response, incident technology risk management, and system auditing, certainly in highly regulated industries. As the CEO and co-founder of Reclamere, Angie manages a team of data security experts that bring extensive expertise to the Reclamere client base. She's an active member of the National Association of Information Destruction, as well as the current treasurer, and she has worked expansively with legal firms to provide litigation support, forensics, and data recovery services. And she is well known as a reputable national speaker. Her certifications and qualifications are too numerous to mention. You can see them listed on the screen. Welcome, Angie. We're excited to have you today.
Thank you so much, Angie.
Our additional expert panelist today is attorney Renee Martin. Renee advises healthcare providers on regulatory and transactional matters that include, to name just a few, patient safety, quality of care, fraud and abuse, compliance, and the development of corporate compliance plans. Now, a significant portion of her practice centers on HIPAA compliance and informational privacy. As a registered nurse with over 15 years of clinical experience, Renee is very uniquely qualified to assist clients in risk management, quality of care, and patient safety issues. She, like Angie, she frequently writes and speaks nationally to healthcare professionals on a variety of health law topics, and she serves on the advisory board of Advanced for Nurses and the editorial advisory board for patient safety and quality healthcare. She focuses her practice in the areas of compliance, HIPAA, e-health, informational privacy issues, hospitals, long-term care, and again, many other related areas of practice. So Renee, welcome. We're excited to have you as well.
Thank you. I'm so pleased to be here.
So let's go ahead and dig right in. You can see on the screen that we have an extensive agenda today. We'll be covering the following topics regarding business associates and subcontractors, everything from how they're regulated, to the scope of liability, and then we'll dig a little bit into breach risk assessment topics and enforcement topics. So I want to go ahead and get started by bringing in Angie Singer Keating. Angie, can you open up by sharing your personal experience in today's environment with how the changes to the Omnibus Rule are impacting business associates?
Sure. One thing that we see is that there are vendors who aren't even aware that they are now business associates. Some of these are folks who handle various ancillary services or handle healthcare billing for different covered entities, and they don't know that the security rule now applies to them as well. The other issue we see are VAs with subcontractors, and maybe the covered entity has done great due diligence on a business associate, but maybe they have no idea that a subcontractor is involved, and wondering, kind of how does the risk profile look for that business associate and those subcontractors. And so really the most important thing is taking the first step in understanding the legal framework that provides for the structure for all parties and eliminate surprises. Would you say, Renee?
Yeah, Angie, I would. And I think one of the key takeaways from today is that this application of the Omnibus Rule and HIPAA and business associate requirements, the deadline for complying has been established as of September 14th of 2014. So we're already up and running with the need to comply. I just want to give some general overview of how the Omnibus Rule changed the landscape for business associates and and the HITECH Act for business associates and their contracts. First of all, business associates were regulated previously through the business associate agreements that they were required to enter into through their covered entities. And frankly, the onus of the compliance was really on the covered entity to identify who their business associates were and to enter into the agreements. But that has since changed, and it hasn't done away with the requirement for having a business associate. But as of now, the Omnibus Rule applies to both business associates and their subcontractors. So they're directly regulated under HIPAA. So the fact that there's an agreement in place is still a requirement, but irregardless of whether the covered entity has done their homework and looked at the business associate to enter into the agreement, the requirements are still there. So to help you understand what you're sort of sucked into here, if you're a business associate or a subcontractor, is first of all, you have to comply with the security rules. That rule is somewhat flexible, and to accommodate small business associates, it's one of the few rules where the federal government has said size matters, and maybe some of the things that you need to do to comply can be addressed. But if you don't have the finances or the financial resources, which of course must be documented, you don't need to comply with all of the security requirements. However, that's not true for the privacy rule provisions. Pretty much many of them have to be complied with under HIPAA, and you still need the business associate agreement to be in place. Next slide, please. And one of the things that the Omnibus Rule did is it actually expanded the definition of who is included as a business associate. It means any entity who, on behalf of a covered entity, creates, receives, maintains, or transmits PHI from a covered entity. So that encompasses a tremendous amount of activity, and pretty much much of the activity that involves PHI received from a covered entity. It also now means that subcontractors of the business associate who also create, receive, maintain, or transmit PHI on behalf of the business associate are sucked into the compliance requirements. I always said to clients, complying with HIPAA is like cutting mold from a piece of cheese. You think you got it, and then lo and behold, however, the mold still is transmitted throughout the cheese, whether you're seeing it really directly or not. So it's a broad-based compliance requirement, and the status of whether or not you're a business associate and a subcontractor of a business associate really does mean you have to look at what it is that you do with covered entities and what you're doing with that PHI. It doesn't solely depend upon whether or not you're required to enter into a business associate. Even if you haven't entered into a business associate agreement, you're still required to comply. Implications for subcontractors, obviously, if you weren't included before and you thought that you were getting a buy, that is not true anymore. The subcontractor of a subcontractor is also a business associate, so it's sort of like tell it down the line. Everybody that's involved with this PHI, that gets PHI, that uses it on behalf ultimately of a business associate or a covered entity is involved in HIPAA compliance. So the obligations also now apply directly to subcontractors. Next slide, please. The definition of a business associate was also clarified under this rule. One of the things that the rule clarified was that business associates include patient safety organizations. And patient safety organizations are those entities who, on behalf of a covered entity, receive and analyze serious event information, incident reports, etc., analyze that information, and then provide an analysis and a means of hopefully preventing those adverse events from happening again. So, for instance, in Pennsylvania, the Patient Safety Authority is considered to be a patient safety organization, so they would be covered as a business associate. The other thing that the rule clarified is that health information exchanges, which are huge data centers that take PHI on behalf of a variety of providers and health plans, etc., they are repositories for that information, and they act as the communication central for plans and providers to speak with one another and to be able to access a patient's healthcare record. So it's a health information exchange, or another word for it is a regional health information organization. The OCR declined to define precisely what a health information exchange is, but it is a lot of e-prescribing gateways. So for physicians that use meaningful use and prescribe medications through an e-prescribing portal, those are included. And it also includes certain personal health record vendors. Not all of them. Some of them are regulated by the FTC instead of the Office of Civil Rights, but that's beyond the scope of this presentation. But the other thing that it did clarify was that data transmission providers that require access to PHI on a routine basis are also considered to be either business associates or subcontractors. So who does that mean? Well, the most telling example is an entity that is a software vendor. Let's say they're your medical record, your EHR software vendor, and they need to access your system to troubleshoot, to update your program, etc. Those are considered to be your business associates or your subcontractors. Importantly, the rule also clarified who's not included, and that means folks, entities that are really conduits or passports for the PHI, digital carriers, the internet, the phone company. I actually had a case that involved FedEx and who lost information on behalf of a client, and we had to look at that and see whether or not that was a business associate of a client. So those are the kinds of folks who have gotten a buy. They are not considered to be business associates or subcontractors. But even those vendors who store PHI, even if they don't intend to actually view it, are business associates. So this has implications for cloud model business associates, which was a big surprise to cloud computing entities. And it also includes folks like Iron Mountain. You know, prior to this rule, they were not obligated to comply because they said, look, all we do is store records. But the OCR has realized that those are some of the folks who have been responsible for some of the larger breaches. So the OCR has said that because they actually store the PHI and the business associate or the covered entity rely on them to keep that information safe and secure, they are included in the definition. Next slide, please.
Hey, Renee, if I could jump in there for 1 second. One of the things that I would like to also clarify under the transmission exception is that in my world, I frequently hear clients tell me that, well, my electronic health record system is HIPAA compliant or it is HIPAA certified. And that is misleading and inaccurate. While there are certain data interoperability standards that the Centers for Medicaid and Medicare will actually certify to, there is no such thing as certifying that something is secure. And so anytime someone says that they are HIPAA compliant or they are HIPAA certified, that needs to be backed up with documented proof. And the other thing that needs to be, that you need to be very skeptical and ask for proof is that when claims are made that our services or what we do falls under the transmission exception, because it's not always clear cut. And there are now service providers that do cloud-based storage that are actually creating clouds that do fall under the transmission exception because they have developed double-blind encryption that works in such a way that they could never, ever have access to the information because they have absolutely no access to any keys. So a lot is changing in that area, and simply be skeptical when you hear the words HIPAA certified or you hear transmission exception.
That's absolutely true, Angie, and I think the other key concept involved in that quote-unquote certification is that compliance with HIPAA, as it is with other types of compliance with other federal rules and regulations, is not a static condition, and that covered entities and certainly business associates and their subcontractors have to be maintaining an ongoing process to make sure that their security procedures and their software and their patches and whatever else they need to do to keep the information safe and secure is being met. So I think to have it certified, even if that were capable of being provided, would give a business associate a false sense of security that would probably lead them into trouble. So that's a very good point to bring up. So this next slide, slide 8, is just a schemata of how information is given back and forth between a covered entity and the various business associates. Important to note is if you are JACO Joint Commission accredited or CARF accredited, or you have an attorney like me who gets protected health information, we all have to enter into business associate agreements with you. If someone like Angie comes in and her firm comes in to do a HIPAA audit or an assessment, they're going to need a business associate agreement also. So that's one of the things that is very important to keep in mind.
Renee, thank you. I want to pause for a moment because in working with Reclamere and even in the clients that we work with, we're beginning to see that concern about what you were just talking about, the agreement itself. coming from clients related to how this actually impacts their current business associate agreements that they have in place. Angie, would you mind taking a moment to talk a little bit about some of the real-world concerns or maybe examples that you're seeing when it comes to the agreement itself?
Absolutely. Renee is one of my favorite attorneys. She's actually my second favorite. My favorite attorney is my husband. But when it comes to HIPAA attorneys, she's my favorite. And sometimes the challenges that I run into with attorneys is that we're looking at business associate agreements from two different perspectives. Business associate agreements can meet the letter of the law in terms of complying with HIPAA and those provisions. However, one of the areas that can be problematic is in the area of due diligence on the business associates. So covered entities need to understand that while the onus to comply with HIPAA is put on the business associate through the agreement contractually as well as through now federal law, the issues around what actually happens when there's an incident need to be clearly understood as well. And reasonable due diligence is absolutely critical on vendors. The financial services industry provides a wonderful crystal ball for us to kind of project our future in the healthcare security and privacy world, because in the world of financial services, there are very strenuous vendor oversight programs where, depending on the risk that a vendor provides, the risk that a vendor presents to the financial entity, they will actually do on-site audits. They will request third-party attestation, and in the financial services world, this is deemed as reasonable care. So in the healthcare world, it is really foolish to expect that, well, we have our business associate agreement signed and that's all the due diligence we need to do. So for instance, if there is a security incident with your business associate, what is their incident response plan? Do they have a risk management program? Do they have any type of routine risk assessments or penetration tests or any other indication that they know how to handle your data in a way that hopefully doesn't lead to a security incident, but if it does, and I should actually say when it does, that they understand and know exactly how to technically comply with what they're legally required to do. And I can tell you that when that's not clear, the burden that it puts on a covered entity, especially when we look at doctors' offices that are acquired by hospitals that have business associates from years back, I can tell you that when those downstream business associates that sometimes the hospital is never even aware of, when they have breaches, they have incidents, it creates a complicated, very expensive investigation to try to sort out who's at fault, how it happened, how you're going to rectify it. And I'm sure that Renee sees that in terms of clients calling her saying, oh my gosh, my business associate might have had a breach, but they're not willing to let us in, or they're not willing to tell us about their investigation. Has that happened to you, Renee?
Yeah, and you know, Angie, I think you raise a couple of significant points from a legal perspective. And this might be something that we'll probably delve into further when we have our subsequent webinars. Everybody thinks breach is what I need to be aware of. But security incidents, as you have just talked about, are equally as important, and more sophisticated covered entities in their business associate agreements, although it's not a required element, which we'll talk about in a minute, differentiate between a security incident and a breach. And why do they bother doing that? Because under HIPAA, when we get to the enforcement penalties, if a covered entity or a business associate with their subcontractors knows of a pattern of activity that suggests to them that the business associate or the subcontractor is not meeting its HIPAA obligations, they are under an affirmative duty to either terminate the agreement or to, if that's not feasible, to impose obligations on the subcontractor to get their act together, or they can stop doing business with them. So those are the kind of things that we'll talk about in the subsequent webinars that are additional nuances to a business associate, subcontractor, or covered entity business associate agreement that you could be seeing, and they're very, very important to understand and to differentiate. And business associates or subcontractors could be found being surprised when a covered entity wants to know how many security incidents they've had, and they ask for a report about all of them. So I think that's a very valid point that you bring up.
And Renee, as far as this slide under the mandated provisions, is there anything in there that you want to touch on that our conversation did not hit on?
Well, this is a framework that's very general. First of all, as a basic premise, remember the business associate can only do with the PHI that which is for the benefit of a covered entity. It can't use that PHI for its own economic or other proprietary uses. So it has to establish the permitted uses and disclosures of the PHI by the business associate. It also has to require that the business associate not further use or disclose that information unless it's permitted or required by that contract or under HIPAA. It requires the business associate to implement safeguards to prevent unauthorized use or disclosure, including requirements of the HIPAA security rule regarding to ePHI. Again, it requires the business associate to report to the covered entity any use or disclosure that's not provided for by the contract, including incidents that required breaches of the unsecured PHI. So remember, the breach is mandatory reporting, whether it's in the agreement or not, but the security incidents may be left to the discretion of the covered entity. It also mandates that the business associate disclose PHI as it's described under the contract so that the covered entity can satisfy certain of its own obligations that are certain inherent rights that consumers have or individuals have under HIPAA, which is a right to access, a right to copy, a right to amend, a right to request restrictions, and also a right to request an accounting of disclosures that fall outside of the what we call treatment, payment, and healthcare operations. The one thing I want to say about the accounting is no final rule has yet been implemented or proposed by the OCR, because that raises a whole host of issues and problems for business associates and covered entities with the main use and reliance on electronic health records at this point. So it's much harder to track. Next slide. The BA, to the extent that it's supposed to carry out the covered entity's obligations under the privacy rule, requires that they adhere to those obligations. It also is required, the BA, to make sure that if the covered entity is under an investigation, the BA is capable of providing with them the information they've received from the covered entity. And quite frankly, it's not used to be just for the covered entity's benefit, but now since the business associate is required to comply with HIPAA's privacy rule and security rule, it's beneficial and necessary for the BA and their subcontractors to be able to demonstrate that. If the contract is terminated and if it's feasible, the covered entity has to get back all the PHI that the business associate has received, or they have to be able to demonstrate that they have somehow or other destroyed all the PHI that they've received. And this is where an entity like Reclamere comes in, so that they're able to demonstrate to the covered entity with reliance that PHI has in fact been destroyed and it's not capable of showing up somewhere else outside of the covered entity BA agreement. So it also requires the same assurances to be obtained from subcontractors. And as I said earlier, there has to be a provision in there that if the covered entity or the business associate with their subcontractors knows of a material term that's been violated, including, that pattern of activity where the business associate or the subcontractor is in violation of HIPAA, that there's a right to terminate the agreement based upon that.
It's very interesting, and I think it's a great lead-in to the next topic. But, I've been involved in conversations with both covered entities and business associates where they really don't understand or even know how to interpret their own scope of liability. In other words, who's liable for what? Angie, can you give us some examples of where this may get an organization into trouble?
Yeah, I think the biggest area where people get into trouble as business associates is that they don't understand that one of the most fundamental obligations that they have under the security rule is to have a well-documented risk management program, which includes risk assessment that focuses on policy, procedure, administration, and risk analysis that targets the technical aspects of the systems and networks that are involved in EPHI. One of the biggest misconceptions is that people think that if they simply have a penetration test of their network, or they just simply do a scan of their network, that they have fulfilled the HIPAA security rule. That is simply one of 79 different audit criteria that is required under the OCR auditor's directions. So it's really crucial, and really the fundamental logic of risk analysis and risk work by OCR is that it is absolutely impossible for you to know the risks that face your organization without having performed a risk analysis and having it documented. And Renee and I team up on those quite a bit, and it's really important to understand that they don't have to be crazy expensive. And there are ways that they can work with folks like myself and Renee where we can set up your program for you and work on getting you completely self-sufficient so that you can demonstrate continuous improvement and due care in handling the PHI that you handle for your covered entities.
That's very true, Angie. And one of the things I'm just going to mention here as an aside before we talk about the direct liability of business associate and subcontractors is I've already had clients who have had meaningful use audits. And one of the fundamental requirements of meeting the meaningful use requirements for providers is to be able to demonstrate that they have done an adequate and appropriate security risk assessment. So this is not just about HIPAA per se, it's also about whether or not your doctor's office, your hospital, your skilled nursing facility, your rehab facility, if they want to get meaningful use reimbursement, which is a huge hunk of change, is going to be able to be eligible for that funding. So keep that in mind too, that as I said, HIPAA comprises everything as that mold on cheese, that it also relates to the meaningful use requirements. But I want to talk.
And Renee,
yeah.
Renee, let me also point something out, because I think it's very important. You know, whether or not HIPAA applies to you or your organization, if you handle medical information, it has gotten to a point where the de facto assumption of reasonable care is that you're going to handle the information according to the minimum requirements of a well-known, long-standing federal regulation called HIPAA. And so many people that are in the kind of the think tanks and trying to predict the future of where HIPAA is going, they completely and thoroughly believe that at some point, any entity that handles healthcare information, be it employers, be it any organization, health clubs, that at some point they will also be required to follow these security provisions as well. So one of the things I love about HIPAA is that in the security rule, the requirements under that are based on the NIST framework, which is the National Institutes for Standards and Technology, and they are absolute best practices and very easy to apply to organizations of any size. So it really is kind of getting to be the quote-unquote standard of care or reasonable measures. Would you agree, Renee?
I certainly would, and that brings up two issues. The first is, it's not just about what the Office of Civil Rights is going to do if you have a security breach or repeated major security incidents. It's about reputational harm. And I think the last thing hospitals and other providers want to have is to be the headline in the local news where patients' information has been compromised and inappropriately disclosed. I've been on the side of responding to a data breach, and patients, you have to understand, and I'm sure if we all put ourselves in the empathetic position of having our healthcare information, our financial information disclosed in a format where we are fearful of our credit rating, of whether or not somebody knows we've had substance abuse treatment, and then you being the entity that's ultimately responsible for that leak, it's that reputational harm. It's hard to put a dollar amount on that. So that's number one. And number two, as Angie has said, HIPAA has become the informational standard of care. And there have been, although patients do not have the right to sue under HIPAA per se, there have been successful case law where patients have sued for tort liability against a covered entity or against a business associate for any one of the informational privacy torts, defamation, public disclosure of private facts, invasion of privacy, where the courts have recognized that that standard of HIPAA in dealing with information is in fact the standard of care, and a violation of that standard of care by a business associate or a healthcare provider, a covered entity, can serve as the basis for tort liability. So you could be looking at not just, as we'll see later, an Office of Civil Rights fine. You could also be looking at potential damages, including what they call punitive or treble damages, if the covered entity or the business associate has acted in a way that is sort of in flagrant disregard or reckless disregard of what their requirements are to maintain that informational privacy. So that's something that has to be figured into the cost of HIPAA compliance. What is your reputation worth to you, and what about tort liability? So I'd like to be able to talk then about what's the scope of business associate liability. Remember, it's direct liability against the business associate, against the subcontractor, or against the covered entity. So there's liability for an impermissible use or disclosure. That means including more than providing that technical standard of what's minimum necessary. So this includes breaches, the failure to comply with any one of the security rule requirements, failure to provide notification to a covered entity. It's still the responsibility of the business associate to provide the notice of the breach to the covered entity. Now, a business associate can delegate that to a covered entity on the under the business associate agreement, but I've rarely ever seen that, and I have never advised my clients to do that because it's hard enough telling a consumer or a patient that there's been a breach of their health information. The last thing you want to do is have that notification coming from somebody that consumer doesn't even know. The anxiety that's associated with a data breach for those affected is really quite significant. The other thing is failure to provide e-access, and e-access means either to the OCR or to consumers who have a right now to have access not only to their paper records but also to their electronic health records. Failure to disclose PHI to Health and Human Services or the OCR to demonstrate compliance by the covered entity, and failure to provide an accounting of disclosures outside of treatment, payment, and healthcare operations. And as I said, that's still under development under the final rule. There also may be other contractual liabilities that are imposed upon the business associate through the business associate agreement itself. In other words, the covered entity can add more than what HIPAA requires. And then remember, there's also the liability for agents and subcontractors.
Very interesting. Angie, I know that you and Renee started getting into this idea of risk assessment and talking about it. And I think in terms of preparation, you know, we all think about when a breach happens, or when we think a breach has happened, that, you know we have to go in and do the risk assessment, and we're trying to identify liabilities and action steps for everyone involved that you just spoke about. But is there a way, Angie, for an organization to do a similar assessment or to prepare for an assessment even before a breach would occur?
Absolutely, and as I said, it's mandated under the law. Who does it and how often is not mandated. However, most organizations opt to have it done through a third party. When Renee and I tag team together to help a client build their risk management program, Renee is focused on the privacy rule and the breach notification rule, and I am focused on the security rule. And so one of the things that is so important and why I got into this in the first place was that in our 10-year history of doing digital forensics, we were seeing so many healthcare data breaches that could have been avoided through a simple risk assessment from well before the incident ever happened. And so the tragedy is that when there is an incident and there's an investigation or there's some type of post-incident analysis, when lawyers or regulators find out that what the root cause of the incident could have been prevented through a proper risk assessment or risk analysis, then that is kind of a double, triple, exponential whammy, because then you get into the kind of words that have very specific, very serious meaning in Renee's world, such as negligence, willful misconduct, gross negligence, and all of those kinds of things. So that's one of the most important reasons that you do a risk assessment, that it is not a static one and done, that it is a continual process that is done initially, remediated, and then remediated and remediated and remediated as the laws change, as your systems change. But it really is the cornerstone, and it really is the foundation. And the OCR has gone on record to say failure to have risk assessments is, they have zero tolerance for it, the same way that they have zero tolerance for unencrypted portable data.
That's right, Angie, and I think that's an important distinction for clients to understand, that the risk assessment I'm going to talk about now is actually to determine whether or not a breach has occurred, but the fundamental groundwork has to be laid long before that to ensure and to prevent that you don't have to go into this type of risk assessment, or the frequency with which you have to do it is minimized. So there's 4 basic questions that have to be answered. They have to be documented, and you have to come up with an answer. The OCR has said that, you know, they will not look over your shoulder and Monday morning quarterback you about what you've determined regarding whether or not a breach has transpired, but you have to document your analysis, and it has to be pretty thorough. The default is if you don't do an analysis, you have to report the incident as a breach. So what are they looking at, and what are your 4 basic questions? Well, number 1, what's the nature and extent of the PHI involved, including the types of identifiers and the likelihood of re-identification? And I just want to stress here that PHI is really a penumbra of other types of identifying information, like your social security number, your address, your plan number, your medical record number, your driver's license. And the idea is that's called individually identified health information, and the degree and extent to which that can be pushed together, piled up to identify an individual, that's what this question is addressing. Secondly, you want to look at who was the recipient of the PHI. Third, was the PHI actually acquired or viewed? And then third, the extent to which the risk to misuse of the PHI has been mitigated. Next slide, please. So the first thing is, what's the information that was leaked? Was it demographic information? Was it clinical data, et cetera, et cetera? And, you know, what's the likelihood you could piece together who this individual is based upon that? Secondly, who was the unauthorized person to whom the PHI was disclosed? So the first thing you ask is, was the person who the PHI was disclosed to under the same HIPAA obligations to protect it as you? You're in good stead, pretty much. Remember, all 4 questions have to be answered, but if it's another business associate or if it's another covered entity, well, then the risk is minimized. And then thirdly, does the individual have the ability to re-identify the PHI? Is it a sophisticated entity that got that information? Next slide. Whether or not the PHI was actually viewed or accessed, and this is where it becomes crucial to have somebody like Reclamere and Angie's team be able to come in and do a full-blown forensic audit, because what if it's a laptop with unencrypted data, which, by the way, remember, if you don't already know, encryption is the gold standard. It's not a breach if the information was encrypted. So is there an opportunity, can you demonstrate that if it's a stolen laptop, that it's password protected, that nobody got through the password? And then fourthly, what was the extent to which the risk of the PHI being disclosed or discovered mitigated? For instance, can the person who received it provide you with adequate assurances that the PHI was either destroyed or not further disclosed? If you fax something to the wrong individual, you fax it to Joe's Pizza Shop instead of a doctor's office, can you call Joe's Pizza and they said, oh my gosh, yeah, we got this and we're going to throw it in the pizza oven and destroy it? And then mitigation is, what is the effort that you have spent or the entity that received that information spent to mitigate further breaches or to lessen the harm of the actual breach?
Renee, one of the things I think that's so crucial, you know, you've mentioned document. In the world of regulators, and also in the world of litigation, if something is not documented, it doesn't exist. And that is so absolutely crucial. And the other thing to understand is that while all of those things that she put up there in a perfect world could be easily solved through forensics, if we all lived in a CSI world. Unfortunately, what's portrayed on television that takes about 42 minutes to solve a case, we can't even set a case up in 42 minutes. And one of the challenges that we have is that particularly when business associates have the information in their custody, we can be incredibly limited in what we are able to do from a forensic perspective. The other important thing to understand is that prior to the Omnibus Rule, when an incident happened, it was presumed to not be a breach unless an investigation proved otherwise. One of the biggest things Omnibus changed is that the burden of proof is now on the covered entity and business associate. The assumption is that if there's a security incident that could be a breach, it is a breach until you prove otherwise. And so that's one of the reasons why when clients call me and they don't have legal counsel on the phone or they haven't yet talked to legal counsel, it is absolutely crucial that we get them involved from the start, because we need to make sure that we're doing the investigation and we're framing the follow-up impact analysis in accordance with what's going to matter for lawyers at a later date. So it's very important to spend the money, and not just any legal counsel. I think that's one of the most important things. People like Renee they have incredible experience in HIPAA, in OCR audits, and in all kinds of areas of healthcare. That is so crucial. And I think one of the things, I'm going to toot your horn here a little bit, Renee, one of the things that makes you stand out as legal counsel is that you have a clinical background. That is incredibly rare. And I can tell you that people who work in security or people who work in law that come out of a clinical setting will have such a wealth of knowledge and such experience that just completely trumps someone who otherwise would be excellent legal counsel for any other type of situation. So you've really got to take the time and find legal counsel that really can help you.
Thank you, Angie. Renee and Angie, I do want to, with respect to time, get into enforcement, because it certainly is on everyone's mind how extensive is enforcement in today's world. How is it being handled? Does it happen only at the time of breach? Are there random audits taking place? So Renee, if you wouldn't mind starting with this one and kind of getting into the current state of the union as it applies to business associates.
Sure, and I think what I'm going to do is slide 16 will sort of skip over, but it was really the first shot across the bow by the OCR, where they used to say, oh, we're only going to be a friendly government agency, and Lord, that didn't last long at all. And next thing you know, the OCR realized that they can't just rely on citizens' complaints. They really need to be more aggressive in their enforcement. So there's sort of two ways or three-pronged approach that they have utilized. The first is with HIPAA compliance audit. So we've been through round one. The OCR they used a big accounting firm, and that's the important thing to remember. From the first round of audits, they were accountants, so they needed a lot of education about what HIPAA is and what healthcare law is. So those first bit of audits are done, and now they're getting OCRs gearing up for stage two. However, at this particular point in time, they're on hold. It's a consequence of manpower and revenue in order to get these audits up and running. Good news is they're not currently doing the second phase, and that means that you have a window of opportunity here to get your house in order, because when they send you the notice that the audit is going to begin, you have a very short window of time to get your documents together and to respond. And anything you do to remediate any of your gaps in your HIPAA compliance doesn't count after you get the letter. The second thing is that they are using is the imposition of civil monetary penalties that can be assessed directly, and we'll talk about that in a minute, against business associates and their subcontractors. They still are relying upon a complaint-driven process, but the idea is here that after the complaint is lodged, if the OCR comes in and thinks you are a bad HIPAA citizen and and the complaint involves more than a mistake or isolated incidents, they have a obligation and the ability now to open up and begin a full-scale enforcement investigation. It's discretionary in the absence of willful neglect, which we'll define in a minute. But again, every complaint is investigated preliminarily. They close down most of the complaints at about 60%. And then the secretary, however, has the discretion, if they enlarge the investigation and if they think you've done a big no-no, to impose civil monetary penalties without even entering into any kind of negotiation with you. Next slide, please. The secretary also uses other agencies, and they coordinate that with the FBI, the Department of Justice, and the IRS. The other important thing to recognize here is they have trained state attorney generals on HIPAA enforcement and HIPAA compliance. And if the state attorney generals wants to take in a position that this is, remember, because they can oversee consumer affairs in most states, they have the ability to bring a large-scale enforcement action against you as a covered entity or business associate. And one of the most aggressive attorney generals so far has been in the state of Connecticut. And I guess here he's trying to stake his reputation on this, or perhaps wants re-election. But that's the state that's been the most prominent so far. Next slide, please. There's 4 tiers of penalties. The first one is you didn't know you were committing a violation. And remember, this dollar amount is per violation, okay? And you have an annual cap per violation of up to $1.5 million. So you could have $1.5 million for not giving a notice of privacy practices. You could have up to $1.5 million for not providing an accounting of disclosure. So it can, the fines can quickly add up. The reasonable cause is a fine of $1,000 to $50,000, and reasonable cause means you have a suspicion that something was going on and you didn't do due diligence to really see if you were a bad HIPAA compliance entity. The third tier is willful neglect. Willful neglect means you knew you were doing something wrong, it was conscious, it was intentional, and you didn't care, and you did it anyway. Now, if you did that and you corrected it before the OCR got involved, the fines are less. But if it's willful neglect and you never bothered to correct it, then this is the highest fine. Next slide, please. Keep in mind that other people used to have a false sense of security if they were a workforce member of a covered entity or a business associate, that, oh, it'll just be the big corporation that'll get prosecuted for the HIPAA violation, but that's not true anymore. It's specifically stated that workforce members are liable. It's a very fact-specific determination without getting into a lot of substance here. The OCR, in imposing their penalties, will look at whether or not you were acting under and how much degree and extent to which you were acting under the covered entity or the business associate's direction, and how much control you actually had over how the services were provided. Next slide.
Okay.
Next, for folks who are business associates, number one, determine if you're a business associate. I don't know if this is true for Angie, but I still have requests constantly coming from my covered entities and sending out business associate agreements to folks where it's unnecessary. So if you're a business associate, as I said in the beginning, it doesn't matter if the covered entity sends you a BA agreement. You need to decide for yourself whether or not you fit that role. Who are you a business associate with? Whom are your covered entities? Who are your subcontractors? You have to understand what to do in the event of a breach, and you have to understand how to negotiate, and what needs to be in, if besides the regulatory requirements, what should be in a business associate agreement. Then you have to develop internally compliant privacy and security policies. This generally means engaging someone like Angie's firm or myself to do a risk assessment from a privacy and a security standpoint. And you can't delay. You cannot afford to be an ostrich and put your head in the sand about this, because, as I said, even if it's just you're looking at an audit compliance, anything you do after you receive the letter doesn't count.
So what I'd like to do at this time, because it is 1 o'clock, is we are going to open it up for some questions. I do want to say that, as I mentioned at the beginning of the session, we will be following up with everybody. So if you need to get to log off, we will certainly follow up with your question if you can't stay on and get that answered. I also want to mention, Angie already mentioned this, but Renee and Angie do work together, and I think you can see in the next steps that they've provided a really comprehensive follow-up for you. So we will get back to you together, and they really are an exceptional, affordable, full-service, consultative, and legal working team. So please don't hesitate to reach out to us. So let me go ahead, and I see a question coming in here, and I'm going to untag this and start typing these questions. Okay, I'll get right into, can one of you speak to what a compliant investigation would look like?
Well, when the OCR has a complaint lodged, is that okay, Angie, if I take this?
Absolutely.
Okay. I've handled over 75 of these compliant, OCR compliance investigations. And one of the things that must absolutely be adhered to is a posture of cooperation. This is not the place for a litigation attorney to dig their heels in the sand and say, let them come after us and subpoena us, etc. What the OCR is looking for is cooperation, and I can tell you that it saves the day. So what you will get is a letter from the local office in Philadelphia. That's the regional office for Pennsylvania or New Jersey or Delaware. And they'll give you the general framework of the complaint, and they will give you the precise HIPAA violation or regulation that the complaint centers on. You will have an opportunity to respond to that by letter. And this is the time where you either you do your best job to present yourself, what you have in place, what you've done in anticipation of HIPAA compliance, what you've done in this particular instance. And if you need to, you fall on your sword and you let them know that we did wrong, we should have done better, and these are the steps that we are implementing to avoid this kind of incident or a complaint in the future. And as I said, about 69 to 70% of these complaints go away at that particular point. So the correct posture, the full explanation, providing all your policies and procedures that address the supposed regulatory violation are absolutely key. I've only had one instance where we've gone beyond the complaint investigation, and unfortunately, it was, of course, as would happen, it was a convoluted set of facts, and instead of just having it be associated with a complaint, there was also some suspicion that the individual who lodged the complaint was retaliated against. So the OCR's ears perk up significantly when that happens. And we were looking at a $100,000 fine for this particular client. However, because we cooperated and were able to show what we did to ameliorate it in the future. We were actually able just to work out a plan with the OCR, and we even got it to be so it wasn't a consent decree or a consent agreement, which if anybody has looked at what's on the OCR's website, it usually means then an agreement that involves perhaps up to 5 years of auditing and self-reporting. So that's what a complaint will generally involve.
Okay. So Angie, I'm going to direct this at you, and we'll take a couple more questions before we wrap up. We're a healthcare technology company, consider ourselves a business associate. I've been hearing talk about a certificate or process that can guarantee that we are HIPAA compliant. I'm directing that to you because I know you addressed that briefly earlier.
Yes, there's no such thing. It doesn't exist. One of the best ways to demonstrate that you are HIPAA compliant is that you have a third-party attestation done through a risk assessment, risk analysis, and you have it. You have the attestation done by someone such as myself, who's a certified information systems auditor. Many CPAs who do auditing of financial and healthcare information that exist on electronically are also CISAs. So it's a really important type of credentialing that demonstrates that you have work experience, you understand the proper best audit practices, and that this third party is attesting to your status as of a particular day. I can tell you one of the things we're seeing is we're seeing an increased number of clients calling us saying, we've never done this before, but our client is asking us for it. Or they will say, well, we did this internally before, but our client says they want a third party to do it independently. So those types of things are happening all the time, and it's really, really important that you take the risk analysis aspect of this very, very seriously.
Okay. And we'll do one more and try to wrap up by 1:10. And this is for either of you. We're a covered entity. Would we really be expected to be sure that all of our business associates are complying with these changes in regulation?
Hey, Renee, let's answer all at the same time. Ready? 1, 2, 3. Yes! Yes. That is the expectation in the financial services world, and it has been that way for probably at least 20 or 30 years. We have financial services clients, and it is nothing for them to require anywhere from a 50 or 60-point audit checklist, or even one did an ISO assessment of us where it was over 140 different criteria with 3 auditors who came to our facility. Yes, you are expected to make a reasonable effort, and one of the most important things is to risk rank them. If you're a covered entity that has thousands of business associates, then you need to look at things such as what are the number of records that this covered entity is handling for us? What is the method that they're handling it? Are they carrying around huge volumes of information on unencrypted drives, or are they handling sheets of paper that one sheet of paper is a privacy violation, but it's one record and it's not a security issue? So those are the types of things that when you set up a vendor oversight program, you can risk rank them into categories that may definitely require an on-site visit, those that will require just a third-party attestation, and those that would just simply require to fill out a checklist and answer yes or no to some basic things. And do not make the mistake that your biggest business associate is your biggest risk. It is actually completely the opposite. Your biggest business associates, some of your very big organizations like GE Healthcare and Siemens and McKesson, they have been doing privacy and security for longer than some covered entities have even been around. The ones that are really crucial to understand are your data destruction provider. If you're still treating your old computers like trash, you need to revisit that program from soup to nuts because you are a ticking time bomb. The other ones are the mom and pop transcription companies that are taking large volumes of information and then using home-based contractors to do transcription or different medical records functions. So yes, you are, and I will go out on a limb here and say that because I know it's a very, very thick limb, if you have legal counsel in your organization telling you that your business associate agreement being executed is all the due diligence you need to do on a business associate, or really do some serious consideration whether or not they might need to go to, I would say, the Pennsylvania Bar Institute and do some remedial training, because it is absolutely not enough, and that is is all too often something that I do hear, and it's unfortunate.
Okay. Well, we're going to go ahead and wrap up right now. As you can see on the screen, there's contact information. Like I said, we will be getting back to all attendees with the link to today's session so you can listen to it again, and doing additional reach outs to you to answer any questions we may not have been able to get to. So Renee and Angie, on behalf of all the attendees, I just really want to thank you for your time. If you don't have any additional comments, we'll go ahead and wrap up, and I hope everybody has a wonderful afternoon.
Well, it's been our pleasure.
It has been our pleasure, and I can't get out of a webinar without saying something controversial, so I apologize in advance to any legal counsel that I may have offended. Thank you so much for having us.
Absolutely. Take care, everyone. Bye-bye.
All right. Bye-bye.
Bye-bye.